Good afternoon, everybody. I appreciate y'all coming today to System Ops on this Thursday. My name is Tim Slocum. For those of y'all that I don't know, I am flying solo today. I'm pinch hitting for our Executive Chief Medical Officer, Dr. Chris DeSimone, as well as our Chief Nurse Executive, Dr. Gwen Moreland. They are otherwise committed today. But we wanted to follow up with this group and just kind of have a broad discussion today, primarily about high reliability, okay? Also, as y'all know, we're going to open it up for questions at the end, and so I'm happy to take those as we go today. So we want to start with HRO, what this is, what it's not, and why we've decided to do this now. So I want to start with our strategy slide, because I think this is something that we're going to camp out on, y'all. There is all kind of change going on at UK Healthcare right now, right? We all know that. We feel that. I mean, I own that. I acknowledge that. But one of the things that I love the most about us, probably the thing I love the most about us, is we have an incredible connection to our mission, okay? We get why we exist. We get it to our core, and I love that about us. A lot of places do this well. I think we are exceptional in this space, okay? And it's you know, I've been thinking about this a lot. I was convicted over the holiday. I had some time to kind of reflect on us. Gosh, in another week, I will have been here a year. Is my year anniversary. So I'm in kind of a reflective mode right now, right? But I've been convicted, I've been compelled to really camp out on why we exist. And y'all, this is it. Everything we do is about advancing the Commonwealth. Everything we do. And we feel that to our core. You know, yesterday is a perfect example. Our ER team is in the room here. Y'all, they did a phenomenal job yesterday. Massive amount of boarders. Our highest census ever was yesterday. We're seeing flu, we're seeing all kind of respiratory work right now. Y'all, that should give you chills. Because those folks came to work, they did the work, and just got on with their day. Now, it was stressful for everybody, and it wasn't just the ER. Our floors did an amazing job. Our case management did an amazing job. Our radiology, our therapy, our teams across UK did an amazing job yesterday. We came together and did great, okay? And it's rooted in our why. We get, we understand, we own why we exist. And I think we've got to lean into that, particularly in times of change, which we're in right now, okay? But I want to start here. Y'all have seen this slide before. This is not going to be anything new to you. But going forward in this year, you're going to see this a lot more because it undergirds why we're doing so much of what we're doing. We got to make sure that we're communicating this consistently. So, advanced care. We are here to provide the most advanced care for Kentucky. Dr. Karff said this well years ago when he said no Kentuckian should have to lead the state for care. We expect, we don't want to be, we expect to be the best and to do it all. It's who we are, it's in our DNA. We expect to lead in this space, at least in the state, if not the region. Second, taking care of our people and partners. Again, this is why we exist. Another thing I love about us is that we have these affiliate networks across the state. We are resources to other institutions across the state. We are leading in provision of care across Kentucky, right? We take care of our people. If you look at our strategy around growing our ambulatory sites, so much of that is around taking care of our employees, right? But then you also look at our partners. Was in a discussion this morning about our partnership with Frankfort Regional. We've talked about partnerships with other providers, right? We do this very well. We are a resource. We are a foundational element of the Commonwealth of Kentucky, and it's in our DNA. And then third is distinction. We believe we are better than everybody else because of our grounding in academics. We are the cutting edge of healthcare here. We are educating the next generation. We are doing the research that's going to dictate to others how care is provided in the future, okay? It keeps us sharp. It certainly keeps me sharp because you've constantly got to be learning, okay? And so I think it's important that as we talk about all the change, everything we're doing, that we stay grounded in this. So today, the conversation is about HRO. And I think of HRO sort of in that second bullet right there. Taking care of our people and our partners. So high reliability, what is that? Who in here has flown on an airplane? All right. When you get on an airplane, what happens? Your pilot's checking things, right? You got a ground crew who's loading bags, right? There's somebody doing that in a very structured way every single time, right? So the weight of the plane stays correct. There's a timer counting down at the gate, the time the door's supposed to be shut, right? When you go to Chick-fil-A, why do you go to Chick-fil-A? Good service, quick service, right? There's a timer. They're tracking their performance. High reliability is no different. Both of those are good examples of our everyday lives of high reliability. They are providing a consistent service, a safe service every single time. They are highly reliable in what they do. And so UK Healthcare, we're on this journey, right? Y'all have heard me say before, so I love college football, okay? I love it. Nick Saban is the best coach to ever do it, in my opinion. You could argue that. Bad as I hate to say it, I think he's the best to ever do it, okay? But something he talks about is he expects out of every one of his players that they perform every down with excellence every time. You'll win the down. If every one of his players does what they're supposed to do every down, his premise is they cannot lose. I have that same premise for us. Now, it demands excellence, right? I mean, let's not shy away from that. It demands excellence. High reliability for us will demand excellence of every one of us. Y'all should expect me to be an excellent COO. Period. You should have that expectation. I should expect Patty to be an excellent director of the ER. I should expect Dr. DeFranco to be an excellent chair of OBGYN, right? So we're raising the bar for what it is we do. But we've got to arm ourselves with the training, with the tools to do that. And that's what high reliability is about. So we're going to formally kick this off in the coming weeks. I'm not here today to do that. That'll come in due time. But it's all about providing safe, consistent care every time we do something. Because at the end of the day, it's rooted in our what? Taking care of our people and our partners. Y'all have heard me say I'm married, I got 3 kids. If my wife, or one of my 3 kids is on that surgical table, you better believe I want us doing a timeout, right? If anybody in this room, if your loved one is on that table, they come in our radiology suite, they're an inpatient, they present to the ER, you want them to be in a highly reliable organization. You can measure that. You track it with metrics, with dashboards. You're going to be hearing about that. You're going to get training around that. You're going to see those in the coming months as we roll this out here at UK Healthcare. So, today really is just a primer for this, but it's going to look like rounding. It's going to look like huddles. It's going to look like visual management boards. It's kind of the term. You're going to see these boards with data on them showing our performance, all rooted in taking care of our people and our partners. So that's the why. So we're going to come back to that quite a bit. So again, formal kickoff will come later, but just wanted to really start with those 2 things. Why we exist in this time of change, and then also preview that for you. So y'all hear us say week in, week out, our next third Thursday is on the 15th of January. And so please do join that. That'll be at noon, as it always is. The next System Ops, this next session is on the 22nd of January. So please join us here. Same email stands, corpcom@UKY for questions for that. Y'all, kind of a premise, if you will, of high reliability is continuous improvement, right? Y'all have heard me say before, I want to be better tomorrow than I am today. That goes for this session. Tell us what you like. Tell us what you don't like. How can we make this better? How can we do a better job of communicating what's going on at UK Healthcare? Because I think, again, particularly in times of change like we're in right now, we got to come back to that. And so please do send our team your thoughts and suggestions. We are all ears to that. So let me pause. Let me ask for questions. What jumps out to the group today?
When's the official kickoff?
That it's coming. We haven't set a date yet. That's a good question. So the question, if y'all didn't hear, was when's the official kickoff for it? We've got to set that date. So we are getting our ducks in a row right now, if you will, to launch that. Y'all, this is going to be the kickoff, if you will, is a multi-month. You know, there'll be an event, obviously, but then the rollout is multi-month. But really, this is how we operate our health system. And so I've been a part of these in the past. Our Golisano Children's Hospital has pursued this journey. And so they can, if you got questions about it, by all means, ask them. They have been on this journey for the last several years. I think they will tell you, Sarah Heck, our Chief Administrative Officer, is in the back of the room. I think if you asked her, she would tell you this is something, it's a commitment every day. It's not a project. It is how we do the work, if that makes sense. So that's a great question. So you should expect to see training for all of our employees coming out of the gate. As we hire people, everybody will be trained on this because it gets to setting a bar of expectation and then consistently meeting that expectation. So that's a great question, Amberly. Thank you. What else, y'all? Quiet group today.
I have another question.
All right.
So will this impact goal setting? So for example, instead of focusing on outcome goals, will we focus on process goals to be able to get to the outcome?
Yeah, it's a great question. So the question's around process goals versus outcome goals. It could be a combination. And so I think, depending on where we are in our journey, it may, at one point we may say, you know what, we're going to measure our adherence to this process. At another point we may say, you know what, the process is down. Now we've got to determine, are we consistently hitting the mark? To kind of use the airline analogy we just used a few minutes ago, right? The major airlines all track their on-time departure rate, right? So you see reports of that kind of every year, who did it best in the country. That's an outcome metric. I guarantee you, Delta or American or United's all tracking those process metrics as well to achieve that on-time departure rate. We will be no different. We will be no different. That's a great question. What else?
What are the expected outcomes of us going on this journey?
Yeah, no, that's a phenomenal question. So what are the expected outcomes? So y'all, as you'd expect, and I should have covered this before, so thank you for this. So we track our outcomes, our quality outcomes in all kind of different arenas, right? We track mortality, we track readmissions, we track MRSA, CLABSI, CAUTI, falls, all of these different quality outcomes. Now there's also all kind of operational metrics. And so days to third next available in our radiology modalities is a good example. Length of stay is a good example. And so we should expect to see those all improve as we're deploying some of our process work, as we are deploying training on standard processes, and we're reducing variability. If we think of our performance kind of as a run chart, if our performance is up and down, as we're implementing standard processes, our variability should go from this to this. So our performance over time should improve in each of those areas. And so, we track quality both internally. It's tracked externally for us by different agencies. U.S. News and World Report has a metric. Leapfrog has a metric. CMS has a metric. All of those are publicly reported. Vizient, we're a member of Vizient's network. We work with their GPO and their quality structure. As you would expect, Vizient will kind of rank us in all kind of different groups of care, if you will. And so we should see our performance there improve. And so it will be a journey. This is not something that's going to happen in a month, nor should it. We want to build this and build the culture, the rigor, the mindset, if you will, to expect excellence of every one of us and in everything we do every day. So, if y'all can't tell, I'm incredibly excited about this. I am very bullish on this for us. I think this is the absolute right next step for us because of the culture we have here. Our commitment to the Commonwealth is unmatched. And I am convinced with that and arming our teams with the tools they need to be successful, that we will absolutely knock this out of the park. So that's a great question, though. Thank you for that. What else, y'all? Yes, sir.
These initial efforts involve King's Daughters and St. Clair's, or is that down the road?
It's a great question. So as y'all know right now, Beyond Blue is coming online. One of the major efforts that we've got right now is a go live later this year, late June actually, for Epic at UK King's Daughters and UK St. Clair. April the 1st is their go live of Workday. And so as you can imagine, they've got some things on their mind right now from that perspective. And so we are going to begin here in Lexington at UK Healthcare. They will come alongside us after the go live of Epic and Workday later this year. Actually, Sarah and Don and I were chatting about that yesterday, as a matter of fact. So they're excited about this journey. They were engaged in the process to get to this point, knowing that we all want to come together on this front. So good question. What else? What else? What else? All right, I'm going to hang around a few minutes. If you've got another question or two, by all means, please do come up and let me know. I do not want to miss the opportunity to say thank you. Y'all, we are busy, busy, busy right now. We have a lot going on just in our day-to-day work, as well as everything going on across the health system. I am incredibly bullish on it. I am excited about where we are today. I'm even more excited about where we're going. But I do want to acknowledge we've got a lot going on, and it's the folks in this room that's making it happen. And so please hear me say, I am grateful for you. I am grateful for you and for what you do every day. All right? Y'all have a great Thursday. We will see you soon.